I want to make a really quick introduction to the video that you're about to watch, just to kind of understand how did I get to this point of making this video. The video you're about to watch may not be interesting to all of you. This is going to be a great big thank you to every employee that works at Rush University Medical Center. So if you are an employee that works at Rush, please watch it. Share with your friends. If you know anyone that works at Rush, please share this video because I've got to figure out how to get it to them. Anyways, what brought me to the just powerful desire to make this video as a thank you to all Rush employees is I went to the chemo center yesterday. We're in the middle of COVID. We're not allowed visitors. The chemo center is filled with very sick, dying people. And it just happened to be a day where there's just a lot of really sick people. The center was filled with, I'm sorry about the airplane going above, but I'm in my outside bubble. I have created a clear see-through tent on my patio so that I can stay inside and safe all through winter. So we're gonna have to put up with the outdoor noises. It's kind of fun because I get to listen to birds. Anyways, very quickly, chemo center. It was really, really hard to be in. It was a very emotional day, and what I realized, we all know this, but what was just very powerful was now the people that work at Rush, everyone from the person that greets you at the door, the security guard, to the person that checks you in, to the nurses in oncology, to the ones that take your blood, to every single person in that building is now our caretaker, whether they opted for the job or not, because we can't have visitors with us. We can't bring our support with us. Those of us that need support emotionally, physically, coming out of treatments, things like that, our tribe, our village, our caretakers are now Rush. They're not just giving us the science and the medicine, they're taking care of all of our needs. It's because it's strange times. Anyways, so I was really, really emotional and full of gratitude. And what you're about to see is the result of that. So enjoy. Hi, my name's Nicole. I'm a stage 4 cancer patient at Rush University Medical Center. And this video is my love fest for every single person that works at Rush. Every person. Because I feel like in the last year and a half, I have probably touched on every person that works there with as much as I've been there. I also just want to say really quickly, I think that if you jump into this video midway, you're going to think it's an infomercial for Rush. I'm not a paid actor. Rush has nothing to do with this. This is a stage 4 cancer patients. Thank you to the incredible people that have provided her care. That's all it is. And as a matter of fact, if you work at Rush, please share this with your fellow employees because I have no idea how I'm going to get it out to everyone. We'll worry about that later. But this is this is a genuine, heartfelt thank you to every single person that works at Rush. In the spring of 2019, I was diagnosed with stage 4 cancer on a Thursday. I was told, left untreated, I had 1 to 3 months to live. The next day, I was admitted to Rush. I chose Rush as my provider. I know it sounds like I just had a day, so that's a quick decision. It's not. I'm very familiar with cancer. I've been a care provider myself for 2 folks in their journey of cancer to the end. So I knew what I was looking for. Looking for the science. Rush has it. We live in Chicago. There's a lot of really awesome places that have the same science. Rush, the other thing that they had that I really enjoyed thinking about for my own treatment was rock star surgeons. The oncology surgeons were aggressive, cocky, and I want a confident surgeon that says, I'm gonna get it. And they have, and they have. And so the thing that tipped it for me, the reason I chose to come to Rush, was you had the science and you had the surgeons. Well, turned out I got an incredible team. Not just the surgeons, I got an incredible team. And I'm not limiting that to my nurses and my doctors. I think that one of the most important things to have during cancer is support. Cancer takes an incredible physical toll. It also takes an incredible mental toll. It's very hard to greet each day when you're suffering and etch out a little happiness or a little comfort or something. And I have had times where I've had to etch out some joy, and it's been made so much easier by the entire community at Rush. So when I was diagnosed and put into the hospital the very next day, I was in the hospital for 15 days. I had surgery on my colon. There was an amazing, cocky woman. Her name is Dr. Dana Hayden. Thank you, Dr. Dana Hayden. Because that woman said, you know what? The other surgeons you talked to are wrong. I think I can get it, and I will. And she did. Anyways, I've had 6 or 7 surgeries. So thank you to all the nurses on the 12th floor, 13th floor, the oncology, what is it, the 14th floor? I don't know, I've visited so much. Thank you to the nurses that allowed me to host a dinner party in my hotel hospital room. I've been in the hospital for like 60 days, so to call it a hotel room makes sense. But thank you to those nurses, because when you tell restaurant industry folks such as myself that there's a tragedy, we show up with food. And boy, did my friends show up with food. And every day we hosted a dinner party in my hospital room. So I appreciate that. I appreciate the people in the CT scanning imaging department every single time, which is, you know, I'm there quite frequently. I get CT scans, MRIs, and ultrasounds on the regular. I look forward to my visits coming to the CT imaging department. CT scans are really an anxious time for cancer patients. And from the people that greet you at the door, to the lovely gentleman that brings you in the back, to the technicians that run it, everyone is so caring and compassionate in their work that they help you get through that day, not just physically, but psychologically. The concierge in the I don't know what you call her job title, but there's a lovely woman in the oncology department, and when you check in for your blood work and to see your doctor, she is there, and I'm assuming to assist you if you don't know what you're doing. But the woman is just a ray of sunshine every single day. I hear cancer patients sitting around me talking about how this woman, she makes you smile. And you know, when you have cancer day in and day out, like even if that smiles for 30 seconds once that day, it's a beautiful thing. And the nurses that joke with you as you come for blood work week after week, the oncology nurses that sit with you when it's gross, and laugh when it's not at you, of course, with you, as you're trying to etch out some joy. The receptionists that take the time to ask you how you're doing and really want to know the answer. To the valet guy, to the parking lot attendant, to the cafeteria employees, to the wonderful people that come in and change your garbage and clean your hospital room when you're in the hospital, Do you know how awesome it is to have someone come in when you're stuck in the hospital day after day after day after day in a bed when you can't, you know, the most excitement you've had that day is because you can lift your arm, you know, to have someone come in and chat with you about nothingness while they're cleaning your room. It's really nice. I walk to distress, and every single time I've been admitted to the hospital, I'm pacing the floors. If I can, I crawl out there. I had a liver resection, and I was known for like walking. Well, you know, I wander all around the floors. I end up with people that come in to clean your rooms or to other nurses or medical assistants or whatever, but everyone's a cheerleader for you. Everyone that you come across, you're not their patient. They like, this matters. And I really want you all to hear how absolutely every action that you have taken, we know, we feel it. We're so grateful. We are so, so grateful. And maybe not always are we able to express it because the grind of cancer sometimes doesn't make us the best, I guess, I'm sure. But know in our hearts that you provide us the science. You provide us the best care. I am so incredibly grateful. And I shout from the rooftop every single day because I have taken care of people and I am friends with people that are in care situations where they're getting the science, but they're not getting compassionate care. And when you have to deal with a disease that demands your attention every single day, and you can't take your eye off of it for a second because that fucker grows, it's important. Having compassionate care is important. And Rush, you crush it. You guys crush it. Thank you.